COVID-19 has raged on relentlessly and taken thousands of lives, leaving the medical world in a quandary. India too has been no exception. Thousands become victims every day, especially in the big cities. It was a big challenge for us at Ramaiah Medical College and Hospital to understand this virus and build a protocol to treat the patients who flooded the hospital. We rose to the occasion and were the first teaching hospital to volunteer to treat this highly infectious disease.
By the end of March and early April, we were able to start a dedicated COVID facility. So we oxygenated all the 180 beds. So we made 2 or 3 beds, ventilator enabled beds. We were also the first probably to enable a dialysis bed also in that. Now from here we have 5 war rooms. From each war room, the consultant outside will speak to the consultant inside as well as the patients inside. Every day on a day-to-day basis, on a patient-to-patient basis, a virtual rounds is done from outside to take care of every patient.
Working out a treatment method, learning the right way to don and doff the PPEs, nutrition for the patients, online consultation, an information hub for the people, a war room where doctors give individual attention to the patients was all part of the training and confidence building measures. Teamwork is now the keyword, which has helped us overcome many hurdles to handle this unprecedented crisis. The process put in place has now become a benchmark in handling this disease.
And in the COVID care center overall, I think the designing, implementation, functioning and the overall picture, I think personally I feel we have set a benchmark, and I think any other hospital willing to start a COVID care center, I think we would be pioneers in this with this experience.
Doctors from all departments have put in their expertise to strengthen the treatment mode.
As a Ramaiah group, we have taken what is said as the first step center. So here we have established in the first step center, that is the screening and then triaging of all, that is of each patient occurs in this center, and then we are ensuring that these patients reach the appropriate hospitals or institutions to get the right care.
By using technology, so our human exposures will come down. What we do is we integrate all the ventilators and your monitors and including the drugs which are going will be incorporated. This will be transmitted outside. There will be dedicated doctors who will be sitting. He gets this minute to minute recordings and he can guide the persons who will on the ground. So virtually it reduces the human exposure.
See, we put them through the process of counseling about the virus disease per se. We put them through the counseling of how to protect oneself against getting infection when they are working with COVID patients. We also taught them that this is not a social disease. This is a disease that can affect anybody. So the ethos and the counseling that is required to take care of any patient needs to be inculcated in the people working with COVID patients also.
What we usually do is we have an orientation program about a few days before these warriors go in, and we feel that more and more healthcare workers are remaining safe at the end of their work than at the start of the pandemic.
As far as the future is concerned, we know that molecular testing is something that we are now comfortable with, and so it could still be on for COVID.
Now, needless to say, the whole experience has been extremely overwhelming. Right from the moment that we get to know that it is our turn to go in next to the COVID OT or ICU or the ward.
When the education or the awareness in the community increases, all this physical distancing, mask wearing, all this hand sanitization, it's more of a community disease and more of a attitude disease, where the mental attitude has to change of the population. So that is the biggest challenge.
We had to remind ourselves that we are doctors and we are here for a higher purpose in life. And throughout our profession, we have only been instilled with the sense that our duty lies with the society and in making somebody else better. So I think that was what was the driving motivation in getting over our fears.
We don't have fear now, and we know how to take care of ourselves. At the same time, we take care of our patients also. So at this point, we can tell that we are much more confident.
We know that in our minds we have to constantly keep ourselves aware of the precautions that are to be taken regarding the do's and don'ts of the disease. Whether we are in the hospital or whether when we go back to our houses or we are in the community.
I think COVID is teaching the whole world. Along with that, we are also learning. We are also learning not to miss the non-COVID other condition which mimics COVID. So you need to have a lot of knowledge about the non-COVID, which we have seen for over so many years, which is very similar to the COVID. So we cannot mess it up, like heart diseases. The heart diseases also will have respiratory problems. She will also have breathing difficulty. That doesn't mean that she is COVID and I don't treat her. But at the same time, we cannot ignore that COVID is not there. So unless and otherwise proved, we have to take them as COVID and treat them accordingly.
For Team Ramaiah, managing this pandemic, a COVID, is not just our duty. It has been a passion. It has been a movement, and it has been an emotion.
We at Ramaiah know for sure that we are here to serve the society in right earnest. We know for sure that the very essence of our existence is our duty to the society. We have demonstrated very well the outcomes of a very strong team effort. We believe in the spirit and enthusiasm of the team effort. We shall keep going to serve the society.
I did the COVID 8 days. First it was very difficult to do with PPE. ಅದಾದಮೇಲೆ ಇವಾಗ ಎಲ್ಲ ಸ್ವಲ್ಪ ಸೆಟಲ್ ಆಗಿದೆ. ನಾವಲ್ಲಿ ಡ್ಯೂಟಿ ಮಾಡಿ ಬಂದಾದಮೇಲೆ ಇವಾಗ ಎಲ್ಲರೂ ನಮ್ಮ ಫ್ರೆಂಡ್ಸ್ ಎಲ್ಲ ಡ್ಯೂಟಿ ಮಾಡೋಕ್ಕೆ ಮುಂದೆ ಬರ್ತಾ ಇದ್ದಾರೆ. ಅಲ್ಲಿರೋ ಪೇಷಂಟ್ ಕೂಡ ತುಂಬ ಖುಷಿ ಪಡ್ತಾ ಇದ್ದಾರೆ. ಸೊ ನಮ್ಮ ಡ್ಯೂಟಿ ಆದಮೇಲೆ ಎಲ್ಲ ಫ್ರೆಂಡ್ಸ್ ಎಲ್ಲ ನಾವು ಮಾಡಬೇಕು ಈ ಥರ ರೋಗಿಗಳ ಸೇವೆ ಮಾಡೋದು ತುಂಬ ಗುಡ್ ಆಪರ್ಚುನಿಟಿ. ವಿ ಆರ್ ಕಮಿಟೆಡ್. ಇದು ನಮ್ಮ ಕರ್ತವ್ಯ ಕೂಡ. ವಿ ಆರ್ ಟುಗೆದರ್ ಇನ್ ದಿಸ್ ಫೈಟ್.
A vital arm of this protocol is the biomedical waste management, which is systematically dealt with every day.
Community Medicine Department conducted a state level awareness program on safe management of biomedical waste management across all the healthcare facilities in the state, which is managing COVID cases. And we also have now initiated a survey on looking at community management of biomedical waste management, also the biomedical waste management at the healthcare facilities, be it the COVID or the non-COVID situation.
We have a team of nurses working along with us. It was a big challenge because we had to reorient all the nursing staffs and the other healthcare workers in order to do according to the guidelines that has been given by the Pollution Control Board.
Every day we generate about 350 to 450 COVID waste and 250 to 350 non-COVID waste in our institute. So it is disposed according to the protocol set by the Government of India.
A plasma bank in the premises is a novel, successful way to treat the infection.
Convalescent COVID plasma is a treatment option available for COVID patients who are in the hospitals in the moderate stage. Hence, Ramaiah Medical College and hospitals have established a state-of-art plasma donation center for the COVID patients, which will be useful for the patients and large in the hospitals. This is a process in which we are taking plasma from the patients who have recovered from the COVID, and this plasma will be transfused for the patients who are in the moderate stage of the disease, who are getting treatment at various hospitals across the state.
Patients have been grateful for the extreme care and compassion by healthcare workers.
MS ರಾಮಯ್ಯ ಆಸ್ಪತ್ರೆಗೆ ನಾವು ಚಿಕಿತ್ಸೆಗೆ ದಾಖಲಾದಾಗ ನನಗೆ ಬೆಡ್ ಸಿಕ್ತು. ಒಳ್ಳೆ ಕಡೆ ನನಗೆ ಶುಶ್ರೂಷೆ ಕೂಡ ಸಿಕ್ತು. ಡಾಕ್ಟರ್ಸು ನಮ್ಮ ಮನೋಸ್ಥೈರ್ಯವನ್ನು ಹೆಚ್ಚಿಸ್ತಾ ಇದ್ರು, ನಮ್ಮ ಜೊತೆ ಬಂದು ಮಾತಾಡ್ತಾ ಇದ್ರು. ಇಲ್ಲಿನ ಪ್ರತಿಯೊಬ್ಬ ನರ್ಸ್ ಕೂಡ PPE ಕಿಟ್ ಅನ್ನು ಧರಿಸಿ 24x7 ಅಂದ್ರೆ 24 ಗಂಟೆಯೂ ಕೂಡ ನಮ್ಮ ಕೌಂಟರ್ಲೆ ಅಂದ್ರೆ ತಮ್ಮ ಕೌಂಟರ್ಲೆ ಕೂತ್ಕೊಂಡು ನಮ್ಮನ್ನ ವಾಚ್ ಮಾಡ್ತಾ ಇದ್ರು. ಈ ಮಾಧ್ಯಮಗಳಲ್ಲಿ ಏನೆಲ್ಲ ವರದಿ ಮಾಡ್ತಾ ಇದೀವಿ ನಾವು, ಸೊ ನಾವೇ ವರದಿಗಾರರಾಗಿರೋದ್ರಿಂದ ಏನೆಲ್ಲ ಮಾಡ್ತಾ ಇದ್ವಿ. ಬಟ್ ಇಲ್ಲಿ ವಾಸ್ತವ ಏನು ಅನ್ನೋದು ನಮಗೆ ಅರಿವಿಗೆ ಬಂತು. ಯಾಕಂದ್ರೆ ನಾವು ಏನೇ ಬರೀಬೇಕಾದ್ರೂ ಕೂಡ ಇನ್ನೊಂದ್ಸಲಿ ನಾವು ಕೂಲಂಕುಷವಾಗಿ ಪರಿಶೀಲನೆ ಮಾಡಿ ಬರೀಬೇಕು. ಅನ್ನುವಂಥ ಮನೋಭಾವನೆ ನನಗೆ ಉಂಟಾಯಿತು. ಯಾಕೆಂದರೆ ಇಲ್ಲಿ ಆ ರೀತಿಯಾಗಿ ಚಿಕಿತ್ಸೆ ನಮಗೆ ಸಿಕ್ತು.
We all tested positive for COVID-19. Our doctors ಮತ್ತು ನರ್ಸಿಂಗ್ ಸ್ಟಾಫ್ ಮತ್ತು ನಮ್ಮ ಅದರ್ ಸಪೋರ್ಟಿಂಗ್ ಸ್ಟಾಫ್ಸ್ ಅವರು PP ಕಿಟ್ ಹಾಕ್ಕೊಂಡು ಬಹಳ ದೇ ಆರ್ ಟ್ರೂ ಕೊರೋನಾ ವಾರಿಯರ್ಸ್. ಆ್ಯಕ್ಚುಲಿ ಅದು 6 ಗಂಟೆಗಳ ಕಾಲ ಹಾಕ್ಕೊಂಡು ಕೆಲಸ ಮಾಡೋದಿದೆ ನೋಡಿ, ಬಹಳ ಕಷ್ಟ. ಸೊ hats off to all corona warriors.
We are also geared up for the possible after effects of the virus.
I think the future is, I think we are going to peak sometime in the near future. Like it's happened in Delhi, it's happened in Tamil Nadu. I'm sure Karnataka also will peak, and then slowly I think it will start receding. Herd immunity is something that's already there, but we know that there could be a chance for reinfection. But however, what I realize is I think herd immunity will finally what will prevail. And this is what is going to be the trend, I think, in the future. All of us will develop antibodies, at least relatively good ones, the IgG, and then I think that will protect us in the long run.
What does post-COVID care in our institution mean? Any patient that has gone home after the initial acute care will be taken care of for the next 2 weeks with a virtual COVID care situation, where our physicians are available for them, our nursing will be available for them as a day-to-day monitoring, so they are taken good care of it. Subsequent to that, that means 1 month following the diagnosis of COVID, we would like the patient to come, our assessment is done, protocols are laid down, and then we would look at what are the manifestation of COVID a particular patient has got. And based on whether it's a cardiological issue, a pulmonary issue, a musculoskeletal issue, or whether it's a neurological issue, patient will be taken care of